Okay, good evening. Welcome, everyone. This is a different presentation for tonight on our TeloYouth Tuesday. We're going to let Surrean be the star of this show, and that is our skin serum. Welcome, Dr. Chris.
Welcome, Dr. Tina. Good evening, everyone. Yes, and let's start out with the Quantum Rejuvenation Program. And again, welcome, everyone. And this one is, rejuvenation inside and out with all our formulas and how they work. And the technology is remarkable because it's just the quantum energy that we refer to means that we turn back time. And the signal molecules have the ability just to change the dynamics that's happening in the life, what's happening in our body. So we enhance stem cell production, we enhance stem cell release, and we activate those stem cells, and they're more vibrant, they're more capable of rejuvenating. So let's look at the whole story, the hierarchy. We're talking about starting out energetically to make for healthy cells. And then the cellular level, we make tissues, tissues make organs, organs make systems, and now we're creating just a whole new body. So it's the structure function of the whole body and the emotional body as well. So we're just, seeing the whole experience metabolically and all the different systems, and then the dynamics of the emotions, Dr. Tina.
Exactly. Well, let's jump into a fun topic. We all want to look younger and healthier, and let's go into the skin. So the skin is pretty complex. There's multiple layers. We start down at our blood vessels, and then we move up through the different layers of the dermis, then the sensory nerve endings, the epidermis. And then, we've got some of the subcutaneous glands here as well. Our muscle, our fat, our collagen, fibroblasts. We talk a lot about our collagen and good fats. And you can see why when you're looking at skin health and even telomega, how we need the good fats. It does help with radiant skin, and we do have studies to show that as well. So you can see that it's very complex. There's a lot going on with skin. And by the time our outer layer of our skin begins to look old or worn or wrinkled, there's a lot going on underneath the skin. Okay, so with our TeloYouth, we focus on the underneath areas of the skin, all of these different layers rebuilding with our stem cells, our immune system. All of this gets rebuilt with TeloYouth, while Surrean focuses on the outside going in. With that, you have a very highly, I want to say, effective way to work at getting your skin much healthier. So it's not about just taking collagen, it's about rebuilding the collagen that you have with all of our exosomes. And as you can see, collagen is the glue that holds our cells together. So
A great picture because of the microcirculation that we're able to regenerate. And so we're
yes.
talking about the collagen here and the renewal of the collagen. And we're getting beat up, right away. It's like steadily decreases 1% every year thereafter, after a year of 18. And so you can see how your skin can really get abused. And I can tell you personally, just having lived in Hawaii and Nevada, the dry state, the altitude, all the things that really challenged my skin. So the new EMFs that we're getting to, that's really a problem. So these are the things that we have to renew, Dr. Tina.
Yes, and when we look at collagen declining, the more that we cannot handle stress, the more we break down our collagen 10 times faster, as a matter of fact. So If you don't handle stress very well and you're emotional, just know that you are moving yourself into accelerated aging. And again, it's from the inside out, breaking down from the inside out. So, what are some of these issues that we can have if we don't have enough healthy collagen in our body? Our bones get weak, saggy skin, poor digestion. When we were doing some research around that, I thought, oh my goodness, that's true because all of the lining of the intestinal tract, collagen is truly important there. Hair loss or breakage, stiff or sore joints, slow wound healing, brittle nails, wrinkles and fine lines. All of these are a reflection of collagen deficiency.
And again, how important it is to be taking, our formulas so they're able to just maintain that inside and out dynamic. And so you're looking at a baby skin in 2 weeks, it's just so soft and tender and just vibrant. And by the time you're 20s, the skin is, we're talking 4 weeks to regenerate. And then 30s and 40s, 8 weeks. And by the time you're 50, the decline is just so much accelerated. So skin aging is determined by genetics and environmental factors that we just talked about, the sun and the skin and how dry it is. And so your lifestyle plays an important role in all this, Dr. Tina.
Right, we're going to talk about cell turnover rate. So, with babies, the cell turnover rate is every 2 weeks. Their skin cells are turning over. And then you move forward in time, right? And by the age of 50 and up, 12 weeks, it's what, 84 days plus? Uh, we can help with this. This is what's so great about our program is helping that cellular turnover rate. And how do we do it? All right. First of all, exosomes from the inside out. Talking about taking exosomes. Exosomes are those instructions. They're the signal molecules that tell your stem cells to renew. So if you have a wound or something going on with your skin, those stem cells need to go to the area to help that wound. Immune cells, right? Even the immune system will go to an area that has been burned or cut on your skin, and the exosomes tell all of the different skin cells to go to the different area for repair. And then we have, if you have damaged tissue, the exosomes again direct and tell the damaged tissue cells how to go through repair and then skin repair. So when we're looking at repairing our skin on a daily basis, it's going to promote these exosomes are going to give instructions that tell your cells to promote collagen production, make more collagen, support any kind of wound healing, enhance your skin barrier so that you can handle, like everyone knows when people typically get older, their skin gets very, very thin. And this helps to create a thicker skin barrier as well. And we've seen this over and over again. My mom, she's a perfect example. She did not start using Surrean or doing some of the things that I told her about until she was 80. Okay, well, maybe 78, about 78. Anyway, she looked better. Her skin, her face, her neck looked better when she actually passed at the age of 92 than what she looked like at 50. It was remarkable. People were asking, what was your mom doing? So it was really kind of fun to share with our family the things that she was doing for her skin.
We talk about Surrean's oligopeptides, and it's just a fancy word for proteins. They're proteins that bind to the receptors on the cell membrane surface with the primary function of activating cellular activity. So we've shown slides and presentations that show this. the chemical messengers between cells. These are what we refer to as the signal molecules. Increase the growth rate of your healthy cells. So you improve the healthy cells and remove the damaged tissue. And then cell proliferation means better blood vessel growth, collagen, a lot, elastin, and the fibronectin production, which and distribution, which is just the whole orchestration that looks at the skin rejuvenating. And the telomega plays a key role also for hydration and elasticity. If I could say
Sure
that
does.
word. Yeah, so it's just a great combination there with all three formulas, Dr. Tina.
Well, yes, and it's so confusing when you look at different, formulas out there for your skin. They're going to say fibroblasts, they're going to say growth factors, they're going to say oligopeptides, they're going to say signal molecules, they're going to say exosomes. All of them are the same exact thing. So they just give different names. Like in our nutritional industry, they're going to give different names for sugars, right? They're going to call it maltodextrin, they're going to call it agave, they're going to call it all these different names, but they're sugars. But when we're talking about these signal molecules, exosomes are fibroblasts, they are growth factors, they are oligopeptides. So I just want you to understand they give different names for things that do the same thing. Okay. Here is a perfect example. Age 53, I was using Surrean, believe it or not, and doing TeloYouth and TeloMega. I did not have TeloMega. Yeah, I did. No, I did not have TeloMega at the age of 53. And when at the age of 60, the big difference was is I did level 2 of the TeloYouth Quantum Rejuvenation program, but I'm going to share my tips and tricks for what I did on the outside of my skin as well, and really started to practice along with taking extra TeloYouth, working, making sure you're getting those exosomes and the proper compounds and nutrients on the inside of your body while you're focusing on the outside. It's frustrating to me when somebody, usually a female, will say, "Oh, what do you do for your skin?" And I want to say, I take TeloYouth and TeloMega. They don't want to hear it. They want to hear about, well, what can I do to go to a spa and have a treatment done? And that is so ineffective and costly. It may work a little bit, but it's not going to do what you saw there in my before and after.
And here's a story of, I believe it's Maggie, right? Your friend,
My
Dr. Tina?
friend Maggie, yep, in her 60s.
Yeah, yeah. So this is a great picture here. So why don't you share a little bit more about it?
Yes, Maggie was teased by her 15-year-old son saying she had a turkey neck. And that is a not a good thing to tell your mother. And she didn't even know it. She didn't realize it. So she asked me what she could do. And she was already taking TeloYouth, but not very much, just the wellness program. So I informed her what she could do and look at 21 days of adding in Surrean and increasing her TeloYouth. Very remarkable TeloYouth and Telemega. Dr.
And
Chris,
then here's an
we have
incredible burn study
very,
here.
yeah, we have very specific peptides that focus on wound healing. And these are some of the study. This is one of the studies. You want to talk about it?
Yeah, well, this was when we really realized what we was discovered is that the doctor that developed this, this
Did our
serum in a
studies. Yeah.
sense, yeah, yeah, studied it, on with third degree burns, which would be just so, you know, traumatizing to the skin and would leave scars. And so here you're seeing with the baby skin fully regenerating in 7 days, remarkable healing. And then after 14 days, you're seeing all the, you damage being away. And then 21 days later, it's almost like it's new skin again. So this is a great story, Dr. Tina.
very little scarring. And yeah, this little guy put his arm in a vat of deep fry oil when his mom was cooking. He was on her hip. But the other thing to note with this is that, baby cells, they turn over faster. However, there's usually a lot more scarring, even with such a terrible third-degree burn. And the serum, the active ingredient, I should say, in the serum was applied twice a day. That was it in the hospital.
And then we have Beth Ann's story, again, another dear friend of yours, Dr. Tina, that really showed how her just tissue totally rejuvenated. So tell her story as well, please.
Yeah, she was she is still is. She takes her TeloYouth and her Telomega, and she was fighting like, no way, this stuff doesn't work. And you can see her before and after. And she decided she didn't even put it up around her eyes. She was just going to test it in this area, her her chin and her neck. And so look at the difference. I mean, just
19 days, just
19
remarkable.
days with her. Nothing else. She did nothing else. Okay. And this guy has vitiligo, and that's where this is something going on inside the body with the immune system. This is also like what Michael Jackson was dealing with, the skin patches, right? Getting lighter. And so when you when if somebody is working on this and they want their skin tone to be more even and balanced out, they do need the quantum rejuvenation program. So they have to work on the inside to get the immune system back into balance, have it regulated properly. And then also the Surrean applied topically. You can see it started to truly even out inside, from the inside out and the outside in.
And here's a gentleman that experienced steam burns. He was in the sauna and just remarkable after applying the Surreon. Saw after 4 days, twice a day, and then seventh day, twice a day, just remarkable rejuvenation in his story as well, Dr. Tina.
Yes, you can see that 10 days. He went 10 days before he would put anything on it. And this is how bad it got. So then you start to see 4 days after putting on Surreon twice a day and then day 7. All right, let's talk about this Surrean Youth Serum. You know, it does contain a very, I want to say, concentrated signal molecules. And 45% of the formula is the actual signal molecules, the exosomes. When we talk about exosomes, remember, keep in the back of your mind that they are heat sensitive. So when we're looking at some of these tips and tricks going forward, keep that in mind, please. But it stimulates your own skin renewal system and increases the hydration because you're going to get healthier skin that's going to hold hydration better. If you are using, which 99% of all humans are, they're putting toxic things on their skin. It's very common that once you start using Surreon and doing your quantum rejuvenation program, your skin is going to start to push out deep levels of toxins. So you could actually get a rash or things could be, coming out through the skin. Okay, so it's not causing you to break out. It's causing your skin to turn over, the rate to turn over faster and move things out from the deeper layers. It will improve elasticity and resilience. It prevents and restores the photo-aged skin. It does increase firmness. It reduces the appearance of fine lines and wrinkles, and it does balance skin coloration. So
One
let's,
thing, Dr. Tina, yeah, before you go further, is that there is only one contraindication, is because it's such a powerful healer that you don't apply it to a puncture wound. And the reason for that is that the surface would heal so fast that it didn't have a chance to heal inside the ruptured tissue. So with a puncture wound, you want to be
yes.
careful how you apply it. in that case.
A
But
deep,
other than that, it's very healing.
yes, thank you for bringing that up, a deep puncture wound. Okay, so let's talk about what we're trying to do with Surrean. Remember, cellular turnover rate declines quite a bit as we age, 30s, 40s, 50s, and higher, right? We start to see up to 12 weeks before your skin will turn over. So, what I have learned is that I want to activate my skin and get the cellular rate to turn over faster than what even Surrean does for us. So you can apply your Surrean and do none of this that I'm going to talk about, and you're going to have good results. But if you incorporate one or two or three of these things, um, you will see your skin change dramatically. So let's talk about them. An exfoliant. You can get different exfoliants that um, take, and what it does is it takes off a layer, like the dead skin cell layer, so that you can actually get the cell rate to turn over and create a signal on your skin that says, hey, you know what? My cells have sloughed off, they've come off, and I'm needing some, more elastin. I'm needing some more collagen built. And you put your Surion on, and it's going to be like a target for those collagen and elastin and blood cells. All of those cells, those exosomes, are going to be told to go, tell those cells to go to that area. Okay, so it's like you're creating a little micro wound. Okay, because when there's a wound, your body is what? Sending a signal, and it's wanting the collagen cells, all of those different cells from the different layers to start activating in that area. So, doing a daily exfoliant is one way that you can do this. Now, with exfoliants, I tell people, 1 day minimum a week, but you can do up to like every other day. Okay. Now, dermablading. This, guys, you shave, you're dermablading all the time. But for women, we can get this peach fuzz, but you can also remove that dead surface, that light surface off as well. And then Surion is going to be able to get in and absorb even better. And it's going to create another little wound like on the face. So, guess what? That means it's going to be sending a signal to have inside the body the collagen repair come, the elastin, and what the skin needs. Okay. So, you're putting Surion on the outside, TeloYouth and Telomega on the inside, and now you're getting dramatic results. There are at-home peels that can be done, and this will go into a deeper exfoliation than just a regular exfoliation. This is going to maybe uh, really truly irritate the skin and create a stronger signal for the repair to happen. Okay. Then we go into microneedling. I've been doing microneedling at home for about 15 years now, right? As soon as I found Surrean. And microneedling, there are, if anyone's interested, there's one that's called Dr. Pen. It's the one I've had for all these years. You can get them online, go direct. And when we go into Q&A, we can talk about it a little bit more. But what is that going to do? That's going to actually create a puncture wound inside your skin. It's like having a little drill of needles going into your skin and creating more wound, right? So then you put your Surreon on, you're taking your quantum rejuvenation program, and it's truly activating the serum even more. Now, if you go have a professional treatment done, they are going to ask you to not put on something like Surreon right away because they want your skin to peel off even more. So you're going to want to work with the professional that you're talking to if you go have a professional treatment. Okay, so let's go ahead and talk about, I'm going to back up. When do you do all of this? So with your Surrean, the first thing that you're going to do, let's talk about morning. In the morning, I do not cleanse my face. In the morning, I might like if by the time and the reason why I don't is because in the morning I've cleansed at night. I've usually done an exfoliant or a dermablade or some kind of, activation on my skin, did my program at night, and then in the morning, what's happening is everything is being rebuilt overnight. The body is regenerating, the skin is rejuvenating. By morning, now all of my moisture has been come back in and retained. Unless I'm doing a really massive peel, then it's going to get dry. But I don't cleanse in the morning. I want to keep all of my good oils intact. Sometimes I might need to add in a little bit of a moisturizer before I put on a sunscreen. And that's all I do in the morning. I do not go into any of that cleansing and whatnot. At night, this is where um, I go after the skin. So I will cleanse, do some kind of an exfoliation, and then put my Surrean on. Or I'll dermablade. Like I'll cleanse, I'll dermablade, put my Surrean on. Or if I do a peel, I will cleanse, do the peel, then you rinse that off, and then put Surrean on top. With skin pen or microneedling, cleanse, I do the dermablading, and then I microneedle in Surrean. I literally put gobs of it on my face and microneedle it in even deeper. Okay, because it's going to get into the deeper layers, those exosomes. So once Surrean is put on, this is really important. You let it dry, and it takes a good minute or two. And then you can add on anything else. You would put on, some people, ladies, men, you like vitamin C serum. You can put that on afterwards, or a moisturizer, and then your sunscreen. So that's kind of a good general. And then one other area I want to talk about, which is so popular right now, is red light therapy. Remember, exosomes are heat sensitive. So you don't want to cleanse and put your Surreon on and then put red light therapy over your face because it actually destroys the signal molecules because of the heat. So this is what I do. I cleanse. I'll do some kind of maybe exfoliation the night I'm going to use my red light therapy. I'll put vitamin C on. I'll do the red light therapy. As soon as that red light therapy is done and comes off my face, Surreon goes on and it activates the Surreon, but you're not hitting it with the heat.